As coronavirus cases across the world topped the 2 million mark last week, the search for a drug that works on COVID 19 has intensified. We've had some progress made in the last couple of months. In fact, we've seen the quickest work on vaccines that we've probably ever seen. Now, to talk about that and a lot of other things, I have as a guest on today's program Dr. Indranill Basu Ray. He's a cardiologist and cardiac electrophysiologist who's currently based out of Memphis, Tennessee. He's also a professor at the University of Memphis. He was formerly a faculty member at Harvard Medical School as well. Welcome, Dr. Basure.
Thank you for having me.
Dr. Basure, I would like to begin by asking about this peculiar nature of the virus, because although the general idea is that it attacks the lungs, in a lot of cases we have seen that people are suffering more as a result of heart disease. Could you explain that connection?
Yeah, there are two things that is going on with this virus. Number one, most of from records in China, from Italy, and other parts of the world, most people who are hospitalized or on ventilators, they are having severe heart problems, including young people who have no history of heart disease. So, and what do you mean? What do you mean by heart problems? Really bad ones. The heart is swelling up just like a balloon, and people have been bleeding from their heart into the space surrounding the heart, what we call pericardial effusion. People obviously have heart failure. So this is one thing that we notice now, that initially people thought this only affects older people but most of the people in newer countries that got affected, for example, United States, almost 40% of the people are younger people. They have no history of heart disease.
Right.
But we find severe heart failure and other problems. In fact, they even reported a case in England where a 47-year-old young lady with absolutely no history of cardiac disease, she had a huge collection of blood around her heart, and the blood was compressing her heart. So those are the things that we find very commonly in people who finally succumb to this disease, and certainly in those people who are in the ICU and are on ventilators.
Right. Doctor, what stage are we in with respect to development of drugs or vaccine that actually work on COVID-19? There are some promising candidates that have come up. One is, of course, remdesivir, which is by Gilead Sciences in the US. Several countries have fast-tracked BCG vaccination trials as well. And then there's also a lot of talk about hydroxychloroquine. Um, what are your views on where we are currently with respect to the drugs?
So let's start with remdesivir. Remdesivir is, I think, one drug that is showing excellent promise. There is multiple trials. One trial that got reported in the New England Journal of Medicine, they had 53 patients, 36 of them, mostly moderate, severe to severe. All of them responded to remdesivir. There are other reports coming in from Chicago and other places. So what the FDA has done, FDA has allowed the use of remdesivir in severely sick patients, under special protocol. So there are tons of patients getting this drug, and looks like it is successful. It is working. It's really working. And we are able to control, number one, the severity of the disease. People who have been on ventilators have come out. We have been successful in preventing shedding of the viruses, and there is marked clinical improvement in people who before using remdesivir was not improving. So that is, I think, I would say, in my opinion, from whatever we have, that could be really the first successful drug against COVID. But obviously, as you can understand, which is a very good news, because this is a disease we had no treatment, no vaccine, nothing. So that's a very good news. But having said that, obviously we need more and more people, different stages. And the more important question is, suppose you just go into the hospital and with mild to moderate symptom, nobody knows or can predict if you will become severe. Right. Should we give remdesivir in those patients? At present, we are not doing that. So that could be one more thing, that instead of letting people or using it only on people with moderate to severe, or people who are already on ventilators, can we use it much earlier to prevent the progression of the disease to that stage? So a lot of questions need answer, but having said that, this is one of the drug that is really, really showing extremely good promise. Now, about hydroxychloroquine and chloroquine per se, the results are, I don't know what word to use. So the initial French study was extremely small. They had only 6 patients in the group that recovered, and they used a combination of hydroxychloroquine and hydroxychloroquine and an antibiotic called azithromycin. Then the same investigator in France expanded the study to over 900, almost 1,000 patients. But remember, there is an open label to study. So when you have open label study, it is very difficult to come to a conclusion because multiple biases take place. Like, see, if I like the drug, I as a doctor might feel my patient actually really got better.
Right.
So that's not the way how medicine works. Okay. Secondly, their initial trial, which went all over the world, it was viral, was not even scientific. What they saw was the nasal discharge or nasal shedding of the virus. They didn't do any blood tests. They didn't see if their symptomatic patient were better or not. So just looking for nasal shedding is, I don't think, appropriate parameter. So everybody took it with a pinch of salt. Unfortunately, around a week back, we had the first American study in New England Journal of Medicine that did not show any promise.
Right.
So now there are some questions that maybe if it's used as for healthcare workers as primary prevention, it might work. But if it doesn't, but nobody really knows. I mean, most countries, even in the US, though people touted hydroxychloroquine, but it's not being used. But I think ICMR in India has put in its guideline that people at high risk, like healthcare workers working with a patient, can take that.
Right.
It remains to be seen through clinical trials if that's active or not. So BCG vaccine-wise, unfortunately, it's still in the very primal stage. Till now, it has not shown promise, but it might in the future. But the good news is that we have a huge number of candidates for vaccine. The one that is fastest is possibly the one with Johnson & Johnson, and that we hope in the first quarter of next year, it should be there. It should be there. There are other drugs also. Some of the new drugs are being trialed now that helps fight what is known as the cytokine storm that happens in COVID.
Also, what's taking form right now? There's a lot of interest in plasma therapy also that's emerging. Could you talk a little bit about that?
Absolutely. Yeah, plasma therapy, in fact, is looking to be promising. So what they do is they take patient who has suffered from COVID, who has no symptoms. And there are at least there are 2 groups of patients. There are 2 protocols that's used in the US. So they take people who has recovered and is asymptomatic from COVID for at least 14 days. They must have a positive PCR test, and they must also have a negative PCR test at the end of 14 days. So this is one group. The second group is people who have a positive test, has had no symptoms for 28 days, not for 14 days. In those people, you do not have to do another test to show the patient is negative.
Right.
And then you also do the antibody titer to see that there's a strong antibody titer they have. And that plasma is taken just like taking blood. And you do all the tests, HIV and all the things that all the sexually transmitted diseases, hepatitis B, hepatitis C, HIV, and rule out all those from the plasma. And that plasma is injected into the sick patients. And initial record, again, that has been approved by FDA under special circumstances in severely ill patient. And it is showing good amount of promise. Initially, both stopping further further viral replication, decreasing the viral time, decreasing sickness time. People on ventilators have got out of ventilators. People on ECMOs have recovered, are on the path of recovery. Nobody has actually recovered, but they're on the path of recovery. But there is, because this is brand new, and it's now that hospitals all over the US have started offering it. But
Right.
also the thing is that remember that a lot of people having COVID, you have to collect them. You have to educate the public that if you had symptoms, you can come. Or if, so that is not easy, you know. I mean, so that. But having said that, enough people have COVID that you can get enough serum to treat people who get sick. Because remember, 90% people with COVID will have nothing
Right.
or very minimal symptoms. They don't even need to go to the hospital. If they have symptoms, they just stay at home, stay locked down, and at the end of 14 days, if one's a symptomatic of symptoms, they are all good. But it's that 10% who develop moderate to severe that they'll end up in the hospital. And out of them, it is around 5% or a little more, maybe 7%, who actually ultimately end up in ventilators and were dying. And that's how you saw those huge dying numbers when we didn't have anything.
Right.
In Italy and in initial stages in New York, till all these drugs came in and those drugs started being used, and the death rate might slowly come down as we progress.
Right. Dr. Basu Ray, I also wanted to ask you about the strategy that different countries are taking, and especially India, and how it's faring with respect to other countries. Because although much of the world is adopting the lockdown approach, some may be more stringent than others. However, there are outliers like Sweden who are keeping their society open. So, in general, what do you think about India's strategy with respect to how other countries are doing it?
So I think India has adopted an excellent strategy because they, as of present, other than those development of medicine that I told you, in general, from when the virus was detected in China, possibly in December. However, the Chinese kept it under tight, and WHO also didn't tell anybody. And that's how the world lagged for almost 2 months before we came to know. And even after we came to know, China was saying, no, there is no human to human transmission and all those things. And now we believe, at least in the US, we believe that by that time, millions of Chinese were actually infected and they were trying to suppress that. Anyway, long story short, this virus till now, only known treatment, whether you call it treatment, whether you call it prevention, is lockdown, period. It's been tried, it's been tested, and we have seen both sides of the coin here in the US. And I'll
Right.
give you an example. New York had tons of people coming from China and all over the world. It's a tourist hotspot. So, so foreign people coming one. So stage one was filled with people with coronaviruses. In fact, people who stayed in New York for 5 days, 10 days, went all around New York, went back home, then developed COVID. Because COVID does not produce symptoms like influenza within 2 to 3 days.
Right.
And it's not over within 5 days. It can remain suppressed. It can suppress your body's fight against it for many days. And that's why it's more dangerous. So
Right.
it can lurk inside your body, make more of its kind, and completely enslave the body with body having no clue and you have no symptoms. So then what happened is that happened in New York. The second thing that New York happened was they did not go for a lockdown, exactly what Sweden is doing now. And then you saw what happened from just 1,400 cases. Now it's over, America has 500 million cases. Out of that, two-thirds are in New York itself. And there are so many deaths also, out of 37,000 deaths till today. Majority are all in New York. So this is one side of the coin. Now let's take the other part of the coin. Other part of the coin is California. California had more cases than New York when both of them started. California governor ordered complete lockdown. So California has a complete flat curve. It's
Right.
2 to 3 weeks now, no death, no. And the same with Washington. Remember, way before New York, it started in Washington. not the state of Washington, not Washington, D.C. And there they did the same thing. So it's beyond anybody's guess that mitigation is only possible by locking down till you have a virus or you have herd immunity.
Right.
And so all the countries that succeeded till now, like Singapore, they do three things. And I think India needs to do all the three things. India has done two. The third is, I think, more important, also important. So one is obviously having a strict lockdown. Second is testing. You might theoretically find low numbers because you're not testing enough. That was the phenomena in New York too. They were not testing enough. Now, when they started doing huge number of tests, like 100,000, over 100,000 people tested. I think today it's around 150,000. You got more and more people with COVID.
Right.
So second is testing. Third is contact isolation. So if X is tested, Y, Z, A, B, C, whoever came in contact with X has to be forced into going into isolation. So these three are mandatory. Say, for example, Singapore. Singapore had small kiosks where they not only tested, but anyone who had tested positive, they will run after them, go to their houses, track them down, and force them into isolation.
Right.
But India is not Singapore, and America is not Singapore. Singapore is 1/3 the size of, say, Bangalore or Bombay, has 1/3 the population of Delhi, and we are huge nations. But having said that, even South Korea had the same thing. South Korea, if you remember, because of Chinese not telling the truth, had thousands of Chinese and even South Koreans who visit China went to South Korea, and they had a huge explosion of disease in the initial years. But do you hear South Korea anymore? No,
Right.
because they possibly the massive number of per 1,000, they are still the highest. Maybe US just beat them, but they were still the highest for testing, and they could bring down the curve. So the rule is this, that you have to quarantine people, contacts, you have to quarantine them. Number two, you'll only quarantine people when you test more and more people and find who the contacts are. And exactly what India did is an excellent job, is creating solid lockdown, and it was extended further. That's, I think, an excellent policy. That was a perfectly brilliant idea. And a couple of other things that India is doing is separating hospitals with COVID and non-COVID. I think that's a brilliant idea too,
Right.
because that will get resources pinpointed or focused to the place where it is needed. Because normal hospital needs to be open, because India is a big country. There are people dying of a lot of other diseases. So it makes sense to do that. And I was told that even railway coaches are being transformed into a COVID hospital. I think that's a very brilliant idea. But I think India needs to do is certainly much more testing.
Right. Right. On the subject of testing, I think currently we have a couple of tests that we talk about in India. One is, of course, the RT-PCR test for COVID-19, and the other is the rapid antibody test. These are the two tests that we talk about in India. Is this standard global practice for testing now against coronavirus?
Yeah, PCR is the standard test. But the problem with the initial PCR was that you had to take swabs from deep into the throat, or very deep into the nose. So that was dangerous for the healthcare workers, because, I mean, as you can understand, those are sensitive spots. So when you push a swab into somebody's nose that deep or into somebody's throat, he can cough or vomit and or just sneeze, and all of them would throw a bunch of viruses into the face of the workers,
Right.
the healthcare workers. So it is dangerous. So now they're trying to come out. Actually, it's already out. Maybe in a couple of days it will be commercialized. Is what is a salivary test. So the salivary test advantage is you just take the swab, put it in your mouth, and with your saliva lick it a couple of times and then put it. So it's no more dangerous. As you have seen possibly videos, cars are going and they're stopping the cars, opening the window and doing these tests. So it's very unsafe when you take a guy and thrust something into their nose or throat. if he's COVID positive, you get all those blasted to your mouth. So, and as you know, tons of healthcare, not because of that, but otherwise also tons of healthcare workers have died all over the world, including here in USA, being in the front lines. So they are trying a better test that is hopefully in a couple of days that should be commercially be available. I'm told Sri Chitra has developed a test also where it targets one of the protein, and it seems to be much cheaper, but we'll have to see. But yes, there are multiple tests coming on. One is the antigen, as you correctly said, and a bunch of other antibody tests have come up. But their actual specificity needs to be determined because, so what I mean by that is a test, we call a test has to have two characteristics. One is it might pick up a coronavirus, then we say it's a specific test. Coronavirus can be picked up by this test. Now, COVID-19 is just one of the coronavirus. There are other coronaviruses too.
Right.
So if it's specific to COVID-19 or not, maybe it's not, then we call that sensitive. How sensitive is it? It may not be very sensitive, or it may be sensitive, it may not be very specific. So we need to find that out for these, because it's a time when before you get a test out, you must be sure what is the validity of the test.
Right.
For example, I'll give you a practical example of that. China initially said that these people were cured of viruses and they had viruses again. So people believe that, but now there's a belief that maybe the test kit they used was wrong. When the test kit said they didn't have COVID anymore, those test kits were not appropriate. See, people, most of the countries like India has ICMR, like US, FDA, they have to go to certain stringent measures. You know, you just can't throw in a thing and say, oh, I've got a new test. They have to go through a set of trial, a set of protocol before. Agreeably, those are fastened during these sort of pandemics. But you cannot throw rules out of the window and just do anything you feel like. There still has to be certain basic rules. So, though having said that, I must say South Korea, which I think follows a more stringent principle, they did show a study where 91%, and so not, I'm sorry, I take that back, 91 patient in a trial was actually found to have COVID again.
Right.
But that's a very, very small number. One should not get worried about it, because by that time you already have antibody in your blood because of the first time. But that's the main thing, that just throwing up a test, anybody can do it. But the test use in mass numbers has to be rationalized after it goes through appropriate protocols to make sure that it delivers what it is supposed to deliver. That is, appropriately detect the disease.
Right. There are also a lot of reports emerging about the infection happening in waves and probably also being seasonal. Is there any truth to that?
I'm not really sure, because so this is the story. And this is we really don't know the origin of the virus. A large people in America, including American government, doesn't believe it came from the Wuhan seafood,
Right.
sea market, because the nearest bat which has carried this virus lives 600 miles from that seafood market. So people now believe it is the Chinese propaganda. They didn't want to tell the truth. And there's a big section of people who believe, they don't think it's a biological warfare. That's a story that China did. But they do believe, because of lack of appropriate protection in the Wuhan Virology Center, which is a grade 4 virology, the only grade 4 virology center, like the one we have in Pune, National Institute of Virology is a grade 4 center. So that deals with thousands and if I remember correctly, I saw a tweet maybe 1 to 2 years back where somebody from Chinese government boasted that they have 1,500 deadly viruses in their Wuhan facility.
Right.
Which was good, but what is not good is, unfortunately, their quality of protection was not possibly good enough. And there have been multiple reports in different media in the US that last couple of years, which leaked to the media, where there are actual official letters to the government that China should take care of it because this could lead to a disaster. So, so first question is, it came out. If it came out from the lab, we don't know, and it got infected. The workers got infected, and then they spread it. Now, going back, if it's really a real bat virus, bat lives in cold, dry climates. So it is expected if summer comes, the virus will go down, at least the infectivity would go down.
Right.
The one thing is that we know the virus dies when you have 56-degree centigrade temperature in a test tube. Because the protein with which it actually attacks the human body, called the S protein, that gets denatured, so the virus is no more living. Now, it is expected that when the temperature goes above 100 Fahrenheit, which it does very commonly in most of Indian cities, and certainly in some of the southern part of the United States of America, rarely in the northern part, maybe 1 or 2 days of the year, but very common in the southern part of the United States of America, it is hoped that the transmission will reduce, because remember, this virus can stay on metal, on air for days. But
Right.
if you have a very hot climate outside, it will kill them. Or it can fly, it's airborne, so it can be in aerosol hanging in the room that a COVID patient went for next 2 hours. So if you and I enter even that room after a COVID patient enter, who you may not know, even that COVID patient himself doesn't know that he has COVID, you're likely to be infected. But those, I guess, will decrease once the temperature comes. But we never know. We really need to know the virus. And CDC says it clearly, the disease control centers, that even they don't know, because this is completely novel virus. We don't know from where it came, and we do not know what its behavior will be during the different infection. Now, talking about waves, there's one more thing I like to point out, and again, that's a theory that has not been proved. There could be more than one strain of the virus. Virus might have changed its strain, and there is some scientists say some of the initial strain may not have been that virulent, but other strains are more virulent. Was India invaded with a less virulent strain? I don't know. It's impossible to know. Or in some states in America, like as you talked about Sweden, there are states in America which have less than 100 cases. Nobody died, no hospitalization. And incidentally, they are also very cold places. Those states are very cold. Like Sweden is extremely cold. Even in summers, you have hardly 50-degree, 60-degree Fahrenheit temperature. Rarely, I think once or twice a day in 365 days do they have a temperature over 100-degree Fahrenheit, which is very, very common in most of Indian cities. So it's difficult to know why they still don't have a huge number, but the numbers are still increasing. It's not that it's completely Sweden. It started coming down. We'll have to wait and see what the policy takes them. But one more important thing to understand, and that's very critical for India also, is when you close this medically, it harms the economy also.
Right.
And there's a saying, and what I say is this: you cannot have treatment for a disease that is worse than the disease itself. So India is a poor country. There are thousands of people who are below poverty line. And these guys might just die, or they can be increased suicide and stuff like that. Even in America, there's last 5-6 days, there have been a lot of protests all over the country wanting the government to open it.
Right.
Open up the economy. They said that there are young people who will never get COVID. Even they get COVID, nothing happens to them, but we want to work rather than starving. And there's the biggest food bank in America called Feeding America, which has got over 200 feeding banks, food banks all over America, which feeds the poor, giving them free food. I mean, they are breaking into their seams because people have no income. So if it happens this to a rich country like India, imagine what would happen to a country like, rich country like the US. You can imagine what can happen to a country like India.
Right. Dr. Basu Ray, one final question. I think right now we are contending with controllables and uncontrollables. Of course, we are waiting for a drug or vaccine that works. But at the same time, as we are all locked down in our homes, maybe there are other ways also which are within our control. And I'm referring here specifically to something that you have expertise in, which is yoga and meditation. What is the link to that and uh, immunity? Could you explain that?
Yeah. So what happens is that whenever you're locked down, human beings are social animals. So being a social animal, when you're locked down, you tend to develop anxiety, depression. Some people are even panicky because, oh, what happens if I have COVID? The question is obviously 90% people, as I said, will never have COVID. But you cannot explain the rational mind, and the mind gets panicky, they're anxious, and they're depressed. Unfortunately, all three of these opens up your immunity floodgates of infection because your immunity gets depressed. So now, for understanding immunity, we have to understand two basic things, particularly about COVID. First thing is something we have called innate immunity, which is the basic immunity that all human beings have. Why? Because every moment, every second of your life, 365 days, 24/7, 365 days, you have billions of viruses and bacteria attacking you. And you got to protect against this. And the body protects against this by what is called as innate immunity. And that includes releasing certain chemicals which prevents these to enter different parts of the body, like your mouth, through your nose, the mucosa of the eyes, or skin is protective itself to a large number of viruses. They cannot enter through the skin. So this is called innate immunity. Now, when you get a particular infection, like you get infected with, say, typhoid, then you develop specific immunity against typhoid, and that is called adaptive immunity. COVID virus, remember, is an unknown novel virus. So human body has never had a taste of COVID. So when COVID enters a body which has never been positive for COVID ever, the body has to fight it using the innate immunity. Now, going back to, and once you're infected, then obviously body causes targeted antibody against the virus, and that's how the virus gets killed. And that's exactly what happens when the question you asked, that is exactly what we pool as plasma from people who have got cured from COVID and give it to super sick people so that they also recover, because that is targeted against COVID. But somebody who's completely new has got the only way to fight COVID is your innate immunity. Now, there are tons of studies all over the world, and these have been done by Westerners who don't understand yoga, meditation, basically physicians, scientists, that show both anxiety, panic attack, depression is decreased by meditation. So meditative exercises like doing simple asanas that we do in yoga, like say Surya Namaskar and things like that, very simple asanas. You don't have to do a lot of them, 10, 15 minutes a day. And then meditating, especially using deep breaths, can decrease anxiety and depression. And there are tons of studies that it also improves innate immunity. And though I don't know the correlation, but I must tell you this, there's been a study in 2014 which actually shows that practice of meditation in cancer patients and other people decreases the production of something called as interleukin-6.
Right.
Now you must have heard that COVID itself actually doesn't kill. So what happens is when you get COVID, you get severe infection, the virus suppresses the body's immunity and goes and proliferate in the lungs, and hundreds and thousands of viruses are produced. So the body gets fooled for many days till body suddenly one fine morning realizes that it has been enslaved by a evil alien bug, and suddenly it picks up all its strength to hit it back.
Right.
And in that process releases a bunch of dangerous chemicals like interleukin-6, interleukin-13, a bunch of interferons, which actually causes damages of the lung and heart. Like as I said, till now, though we have much more studies to do, one or two patients with severe COVID who had undergone MRI, they couldn't actually find COVID
Right.
in the heart as such. So it looks like even the heart, the circulation, the lungs, they are not directly, may not be directly affected by the COVID. They are more directly affected by this dangerous chemical that comes out of the body. And now, as you know, we have a drug, tocilizumab, which is specifically being used in rheumatoid arthritis to block interleukin 6. So FDA has allowed compassionate use, which is a special protocol to use in this patient who was severely ill, uh, the use of this drug. And initial response, there was an article that just got published in JAMA, Journal of American Medical Association, which says initial results are promising.
Right.
So, but I mean, what is better than your body's own capacity to modulate your immunity by doing meditation? And protecting you, increasing your innate immunity, as well as preventing anxiety, panic attack, depression, which comes with being in the lockout.
Great. Thank you, Dr. Basu Ray, so much for joining us on the program today. Thank you so much for sharing your insights.
Thank you very much. It's my privilege. Thank you.